Moyo wenye afya ni kiini cha afya njema kwa jumla katika mwili wa binadamu. Hivyo, kutunza moyo wako vyema kunazuia magonjwa ya moyo na kupunguza hatari ya mshtuko wa moyo.
Heart is a small organ located in your chest, which basically contains muscles and vessels, that's blood vessels, and its majorly its work is to pump blood out of your heart. It serves as a human engine.
Aghalabu, ili kudumisha moyo wako, unastahili kufanya mazoezi mara kwa mara, kula lishe bora, kujitenga na uvutaji wa sigara, kudumisha shinikizo bora la damu na kiwango cha kawaida cha sukari.
So smoking is one of the commonest cause of heart disease. Okay? Particularly heart attack in the elderly and in the adulthood. Okay? Healthy lifestyle still takes a chance. Okay? What do we mean by healthy lifestyle? One, eating healthy. Okay? Reducing the amount of salt in your food. Reducing this solid fat in your meal. Okay? Keeping a well exercised body, okay, keeping a low body mass index, BMI, low BMI, okay, having a cholesterol free food.
Iwapo haya yote hayatatekelezwa, basi moyo wako unakodolea hatari ya kuzuka kwa magonjwa, na kama anavyoelezea Daktari Simon, ni vizuri kumwona daktari mara kwa mara ili kubaini iwapo mtu ana dalili za ugonjwa wa moyo.
So the most important thing is early diagnosis, early treatment. Late diagnosis, poor prognosis. Every disease is worse. Yeah. If not treated, it will of course give you the worst. Yeah. So every heart disease is the worst. So the worst is the worst. If discovered early enough and treated, the disease, some of the diseases are convertible. They're actually treatable. So it's treated and you get well, the disease disappears. But if it's not discovered early enough, or it's not discovered in the early phases, then treatment becomes very difficult. So of course now ends up being worse. Okay?
Aidha, daktari anaelezea kwamba watu walio na umri wa kati wamo katika hatari ya kupata maradhi ya rheumatic fever iwapo watakosa kufanyiwa uchunguzi wa kiafya wanapohisi machungu kooni.
If we do a cardiac examination, we find something we call carditis, okay, or pericarditis. Okay, we can either do an ECG or echocardiogram, and we'll find we'll for sure get there's a carditis. All those are clinical symptomatology of a rheumatic heart disease. That's for the adolescents. That's the most commonest disease in adolescence. In adulthood, the most commonest cause of disease is coronary arterial disease, what we call heart attack. Okay, and the signs are very clear. Is a severe tightening chest pain, okay, particularly on the left side of the chest, which basically migrates to the left arm and to the upper jaw. Okay, severe and stabbing in nature. Okay, that's clinical characterization of a heart attack. Okay, if it is not diagnosed at that particular time, then someone develops difficulty in breathing, someone develops sweating, someone developed difficulty in walking for a long distance. You can't run. Your lower limbs now start swelling. Okay, all those are clinical symptomatology of heart attack or heart disease.
Pia, watu walio na umri wa juu wanashauriwa kupata lishe bora, kufanya mazoezi, kujiepusha na mambo yanayoweza kusababisha msongo wa mawazo na kujitenga na uvutaji wa sigara. Kulingana na daktari, jinsi umri unavyosonga, ndivyo moyo wako na mishipa inaendelea kuwa na nguvu zaidi.
In the old age, majority of the diseases as a result of now the advanced age, okay, and what we call degenerative cardiac changes. Sometimes some of them are not treatable at all. okay, because they are occurring because of the age, and your body must age. So what we particularly focus on is most of the patients will complain of lightheadedness, coughing a lot, especially at night, when they go to sleep, chest pain, which is still unresolving to treatment. Some of them complain of lower limb swelling, and many others. But majority of those elderly people, of course, now have another comorbid, like the hypertension and diabetes, okay, which basically worsens or the progression of the heart degeneration. Yes.
Ni muhimu kutambua na kutibiwa magonjwa hayo mapema iwezekanavyo ili kuzuia magonjwa haya yanayosababisha ugonjwa wa moyo. Joy Nzula, Undugu TV.